Bruce Cruser, Executive Director of Mental Health America of Virginia.
What inspired you to get involved with the Mental Health of America of Virginia?
Oh, well, I think for most of my career, I had worked in community corrections with alternatives to jail or prison and incarceration. But one thing I realized over time was that so many of the people who were caught up in the criminal justice system were really dealing with untreated trauma. And they might be self-medicating through drugs and getting arrested or lashing out or inappropriate behavior. But so many times the underlying causes had to do with mental health issues that had not been addressed. So that was one of the reasons I left that field and then was fortunate to get a position with the nonprofit Mental Health America Virginia. So really it is, I used to say that corrections was the last frontier, but I really think mental health is sort of the last frontier, and really enjoy the work.
Yeah, what are some of the initiatives of the organization?
Well, one thing that we're very proud of and is growing is our peer-run warm line. So it's not a crisis line or hotline, but it's anything just short of that. So the warm line helps keep people out of crisis, and it's anonymous. And the person that answers the phone on our end is someone who has had their own experience living with a mental health condition and has been in recovery and has had training to respond on the warm line as a peer recovery specialist. So that has been a lifesaver, literally during COVID, when it was hard for people to leave their apartment or house or to see a therapist, but they could call the warm line. So we were already virtual in that sense. And then the number of calls increased dramatically. It's leveled off some now, but it's still pretty high level. We get about, we might get 5,000 calls this year, and each caller is treated, again, it's anonymous. So we're really proud to be able to keep expanding that warm line, and each caller is treated individually and non-judgmentally. And if they just want to talk, we just listen. If they want to explore like a self-care plan or identify resources that they might have available to them that they didn't know about, then we can help with that. Or if it really is a crisis call, then we will do a warm handoff to the 988 number or their community services board crisis line. So we're really proud. We've added texting. We have Spanish or bilingual operator on a few nights a week. And then we're looking to hopefully expand into a chat function as well to make it more accessible to younger folks who might prefer that way of communicating. So that's really something we're really proud of. And of course, we also do recovery education programs for people in recovery. It's peer run, webinars that are free. And then we also do some advocacy work with the Virginia legislature and policymakers, where we work with our other partners in the mental health world to try to bring about more attention and funding for mental health services in Virginia.
When I was doing my research, I went on your website and talked about how people were treated, just decades ago with mental health issues. Do you see even just the talk of suicide prevention and mental health getting better than what it once was?
Yeah, that's something I've really noticed a lot, particularly in the last few years. In our view, the sooner that people feel, if someone has an issue that's bothering them, often what prevents them from getting help is the perceived stigma associated with some kind of a mental illness, right? But I think that's changing, particularly among young people. We see a lot more willingness to talk about mental health and what problems people may be having. So I do think COVID actually helped change that a little bit, because so many people who had never identified as having a mental illness or dealing with mental health. So many people were faced with this during COVID, with having some severe anxiety or panic attacks or being depressed, being more isolated. So they were cut off from their normal healthy support systems. So things they didn't even realize they were doing for their mental health, like hanging out with friends or having or exercising, that they thought was just for their physical health at the gym. But it turns out that helps your mental health as well. So many people in the general public started realizing that they needed to pay attention to their mental health and identify that. So I do think it's a gradual change, but I think we're seeing welcome changes there, with a much more willingness of people to talk about mental health. And the sooner they do that, and the sooner they're going to reach out for help if they need it, and then the better the outcomes. It's just like with the broken leg. If you wait a week to go to the doctor, it's not going to have as good outcome as if you go right away. So that's something that we were definitely encouraged about.
I know for me, I was diagnosed with bipolar disorder 2 at 37. I'm 41 now, but that was, 37 years of not knowing what were the issues. So, and then, even with the stigma, my mom had a friend who was at a mental institution at the time. And then I was afraid, or am I going to be taken away? So just thinking about the kids nowadays, it is helping people just share their stories.
Yeah, I think it is. You see college age kids talking about it and getting natural peer support from their friends, right? Without even calling it that. Yeah. So we're really, there's a lot more attention. And the good thing is too, that it helps fill the gap that is a national gap, really, in the number of trained mental health professionals available to help people. Because we definitely have a shortage of mental health professionals. In Virginia, there's a wide variety of resources. In Northern Virginia, you might have a lot more psychiatrists, for example, whereas parts of Southwest Virginia, there isn't one at all. And so telehealth has helped in that regard, but peer support has also helped, where people can reach out and get support from each other. And it doesn't take the place of a psychiatrist or medication if that's really what's needed, but it helps complement that and help fill in some gaps.
I live in Prince William County, Virginia, and in 2025-ish, there's going to be a crisis recovery center coming. With a center like that, does it help not only the people, the families, but does it help like first responders in bringing people to the right place?
Yes, and I've read about that pending place in Prince William. I think it's exciting to see that. I think that's a great example of where Virginia's headed.
Yeah,
we've had so much emphasis over the last decades of just, you see a psychiatrist or a therapist, or you have to go to the hospital. Well, the reality is there's a lot in between that is showing, statistically great outcomes if you have a continuum of care in the community. And not everybody needs to go to the hospital. In fact, a small percentage of those, even those in crisis, really have to go to a hospital in order to get the help they need to get out of the crisis. If there's a crisis receiving center, the crisis stabilization centers, I think the mobile crisis teams that are being placed around the state, so that someone calls 988 instead of 911, which is the new number for a mental suicide or crisis support helpline. You can call that number, and the immediate default is not law enforcement response, but it may be that something can be a trained professional mental health provider can be on the phone and be helping the person perhaps resolve it on the phone. If not, the goal is that a mobile crisis team could respond to the caller's residence with a mental health professional and perhaps a peer supporter, and then resolve the situation right there. And if need be, take them to a community crisis receiving center for 24 hours or so, which may be all they need, and then be hooked up with ongoing community care to help prevent them from having another crisis. All of that saves the state money, but most importantly, and it relieves law enforcement from having to become involved in so many cases, which ties them up from other responsibilities. But most importantly, it's less traumatic and more getting help sooner to the person who needs the help. So we're really excited. Prince William is kind of ahead of the curve in getting this continuum in place.
Yeah. How does it feel for you to be helping people?
Well, it's very rewarding, and really, I'm not doing the direct service so much. Right. We're more raising awareness and public education, and we do. I have the people that work with me who are peer recovery specialists providing support on the warm line, but I get a lot of satisfaction just hearing their stories. Hearing how they took a call and how the person told this is the first time I've ever had somebody truly listen to me. It's made such a difference. I really value the support I get. So they share those stories with me, and I get a lot of satisfaction out of that, because I feel like, when I'm writing that grant or doing that budget report, it really does have a meaning. It really does make a difference somewhere. So I get a lot of satisfaction out of that.
What do you do to help your own mental health?
Oh, well, we have to walk the talk, right? We have to practice what we preach. And I'm not so good sometimes with setting those boundaries between, work and home, but I do make sure I get outside every day. I take a walk every day. That's so important to me personally. And what works for me is maybe different than what works for you or someone else. We have to find our own supports and our own kind of lifestyle that supports our mental health. It's different for each person. But for me, it really is getting enough sleep, eating right, and getting some exercise, preferably outside every day, getting some sunshine. Those things I make a priority in my life so that I can be available to give 100%, to helping others and my job. And also make sure that I take some breaks. I need to build in more days off. I tend not to always take the time I should take, but I'm working on that. Yeah. And also have good support. I mean, I have family that I can talk to who will listen and provide support. And I think that's also very helpful.
Where do you want to see the organization, say, in the next 3 to 5 years?
Well, I think we're really at a point where we could grow significantly in order to reach more people. I mean, the 5,000 calls on the warm line a year is, triple what we were doing, some years ago. But it's just a drop in the bucket compared to the potential resource that we could be statewide if more people knew about the warm line. So that's one piece of where I think in 3 to 5 years we'd really like to grow that significantly, and have more people be aware of it and use it. Plus, I think the organization could do a lot more in the area of just general increased public awareness and support. And then the advocacy part of what we do in conjunction with our partners, because that really helps leverage our strengths. For example, with NAMI Virginia and with Voices for Virginia's Children or Vocal Virginia, Sarah Virginia, we all are working towards making Virginia a leader and not a follower in terms of supports for people with behavioral health issues, and building that continuum of care that I talked about. So I'm hopeful that next few years we'll be able to have much more impact and around the state, and not just in Richmond. So, we're the state affiliate of Mental Health America, but there are local affiliates in Virginia with Mental Health America as well, and they do great work in their locality based on meeting a specific need there. So there's not one size fits all. I mean, every Mental Health America affiliate is different because they have the flexibility to provide services that may be whatever's needed in that locality. And across the country, there are lots of different models. And I think what we can do and what we're trying to do is learn from the others, see what else is out there. Where have some other affiliates across the country been able to identify a gap or a need and then position themselves to fill that need? Government can do a lot. We depend on the state and the localities, but the reality is it's nonprofits that end up kind of leading the way and seeing where there are gaps that need to be met. So we're really excited about some opportunities down the road.
Yeah, and Mental Health America overall has been around for a very long time. What does it mean to you to be advancing the mission, especially in Virginia?
Yeah, well, it's really a unique opportunity in some ways. Virginia it's been around almost as long as the National Health America. I think they're over 100 years old. I think we're 80, 85 or 86 years old. But the tradition to me is a proud one, because in Virginia, the initial kind of issue that created mental health, what is now Mental Health America Virginia, was the conditions in the state psychiatric hospitals. And it was in the 1930s. So it was during the time of eugenics, and there were pretty much every person who was sent to the state mental hospital was forcibly sterilized. And so there were, fortunately, civic leaders and clergy and medical people who came together to create an organization to help change that. And at that time, it was called the Virginia Society for Mental Hygiene. It was part of the mental hygiene movement, right? So name has changed over the years, but that advocacy and public awareness is still a big part of our mission. Yeah. So it's a unique opportunity for me, and I'm just really pleased that I've been able to, be part of it.